Hello everyone, and my name is Sarah Moorhead, and today for our demonstration course, I'm going to teach you guys how to properly give injections and watch out for biosecurity within poultry. So when we're talking about our animal science, we have talked about all sorts of livestock, we have talked about cattle, and we've talked about equine and pigs and poultry. So now we're going to get into a little more about biosecurity. So this past weekend, if you guys aren't poultry enthusiasts, like I am, the Ohio Nationals was last weekend, where they had 8,000 birds participating in the show. So on top of the 8,000 birds, they had roughly 1,000 to 1,200 in the sale area. Unfortunately, I could not go, so I had some friends pick up some birds for me. We do breed here at the farm, and we breed for SOPs and endangered birds and that kind of thing. So this is a modern game phantom. His color is birchen. He is beautiful. He is roughly 5 months old, but if you can see, he's kind of under the weather. So unlike other animals, poultry are very good about hiding their symptoms. So I always have my friend come look at them and check them out before they, bring them home for me. And when she got them, they looked wonderful. His two hens, they look wonderful, but he, on the other hand, is a little puny. So that is our number one reason for biosecurity. Biosecurity is super important no matter what you do, because you don't want to bring in a problem to your farm. So I'm currently in my quarantine barn. In here, houses in front of me is my barn cat. But on the other side is anything new or anything that doesn't look good or under the weather. So our quarantine birds, they stay in a pen for 31 days. It's been roughly 6 days now, and we can see that he did not handle the trip very well, and he has a respiratory. So when we look for biosecurity, obviously you saw the sneeze, but we also have a swollen eye, and we have a little snot coming out of our nose, and because he's got a respiratory, it's coming out of his eye because their sinus tract is so small. So for order to fix that, he's just got a common cold. It was dusty in the trailer, it was dusty in the area, and he got stressed from moving he came from Wisconsin, so it was Wisconsin to Ohio, from Ohio to Paducah. So he's a little stressed. So I'm gonna sit him down and we're gonna talk about how to give an injection. So just like everything else, chickens can get injections when they're sick, and so we have to figure out how to properly manage that. So today we're going to administer LA300, which is a great antibiotic for respiratory. So the first thing we need to do is clean our top. I have already done that because I did the injection beforehand, but we use a alcohol wipe. So let me get it for you. It is right here. So we want to make sure this top is completely clean. That way our needle goes into a clean vial. So we're just going to go ahead and get that nice and clean. Perfect. So now that it's clean, it is ready to have our needle administered. One thing we do within everything is we never, ever, never use a dirty needle when we put it into our thing. If you put a dirty needle into the vial, it causes bacteria and all other nastiness into our full antibiotic, and we don't want that at all. So I have already I've already pulled up the injection because it takes forever, but I'm going to show you how to properly pull it. So one thing we have to think of is needle safety. We never want to recap a needle. So we go through and we would put it at an angle, and we pull, and we hold it like this until it completely fills or where we need it to be. So I'm not going to do that because I've already done it. So I'm going to set this to the side, and we're going to pull our guy. So LA300 can be both intramuscular and subcutaneous, meaning it can go right under the skin or it can go in his muscle. With poultry, it's easier to do sub-Q. So what we're going to do, everything needs to be as calm as possible because poultry can get very, very scary sometimes, and you don't want to poke yourself. So with him, we are going to flip him upside down. When you flip birds upside down, they completely paralyze. So here we go. Next, we're going to take our injection. We're going to pop the top. Like I said, we never ever put our hands near the needle. And we are going to inject. So we're going to go sub-Q. So we're going to go right here in the breast meat. And we're going to slowly administer. So it is in his skin. And we're going to put our finger where the needle is just so we can feel it and make sure it goes through. So we are currently injecting LA 300. And we want to rub as we administer to make sure it is evenly administered. We're slowly administering. And we are finished. So we're going to take it out of him, and we're never going to cap our needle because we're not going to hurt ourselves. And then I'm going to go put this right in the sharps container. That way nobody can get hurt, no animal or human. So now we're going to put him back in his cage. We're going to clean his eyes. We're going to do that again in the next 7 days. But just as a reminder, when we do any antibiotics given to an animal or any other vaccination, we never want to touch our needle. We never want to have the chance of hurting ourselves, getting the medication into us or their bodily fluids and their blood, because that is not good for us either. And also, we're going to put him back with his friends and away from others. Biosecurity is so important. One sick animal could cause the death to an entire flock or herd, and we never want that. You have to bring in new animals to help with your bloodlines, but you never want to hurt the ones you already have. So I hope you guys learned a little bit about how to inject a chicken when they are a little sick, and we hope that this guy gets better. He should within the next 3 or 4 days. See you guys.